Concussions are getting the attention they deserve today because they're a type of brain injury. The effects of concussions can be serious, which is why they need proper medical treatment. Concussion is typically caused by a fall, bump, or blow to the head. These injuries can cause a loss of consciousness, but most concussions do not. Because of this, some people have concussions and don't realize it. It is also different from other forms of head injuries that may cause bleeding inside the head, which require hospital admission and maybe surgery. Concussions are common, particularly if you play a contact sport such as football, but every concussion injures your brain to some extent. This injury needs time and rest to heal properly. Most concussions are mild and people usually recover fully. Concussions are brain injuries that interfere with the way the brain works. The signs and symptoms of a concussion include headache or a feeling of pressure in the head, nausea or vomiting, balance problems or dizziness, double or blurry vision, fogginess, irritability, or difficulty in concentrating. Most sports-related head injuries are mild, and your child would have a complete recovery. However, concussion in children can be serious, ranging from temporary memory lapses to fatal brain swelling. Concussion in children sometimes goes unrecognized because the symptoms may not be noticed right away. Your child will need time to rest until his or her symptoms are completely gone, which usually takes several days. Your child should rest from both physical and thinking activities because these can worsen symptoms. Another blow to the head while the initial concussion is healing can occasionally result in fatal brain swelling, a condition known as second impact syndrome. Also, a young athlete who sustains a concussion is at risk of developing post-concussion syndrome. This causes symptoms such as headaches, dizziness, irritability, and difficulty with thinking skills such as memory and attention. These symptoms can be particularly confusing for a child, as well as his or her family and teachers, if the child doesn't realize he or she has had a concussion. Once a child has sustained his or her first concussion, he or she is at a high risk of sustaining another. To protect your child from head injuries, insist on appropriate and properly fitted protective equipment, such as a helmet, during sports and other activities. Helmets don't protect against all concussions, so you need to make sure your child knows that even a mild bump or blow to the head can cause a concussion. Also, inquire what the policy is for taking a player off the field following a knock to the head and the decision process of when to allow play again. If you think your child has sustained a concussion, seek medical help immediately. Your child's doctor will determine how serious the concussion is and when it's safe for your child to return to sports, school, or other activities. First, a physical exam by a doctor is needed. The nervous system will be checked. The doctor will look for changes in the person's pupil size, thinking ability, coordination, and reflexes. Tests that may be needed include a head CT scan or a MRI of the brain. Occasionally, an EEG, a form of brainwave test, may be performed. A more serious head injury that involves bleeding or brain damage must be treated in a hospital.